And welcome to our live stream at Deuk Spine. We are taking care of a patient now who's traveled to Florida from Georgia, not too far away, but he's been suffering with chronic debilitating lower back pain, and he has several different causes to his back pain. One of them being does he have a stimulator? Let's get an AP. One of those causes is herniated discs below a fusion that he had done years ago. The second cause is the sacroiliac joints. A little higher. Shot? Nothing? All right, good. Now you can you see the x-rays there, Henry?
Yes, we can.
So that's a front back x-ray. You see the screws and rods. Those screws and rods are at L3-4. We are going to be working below that at L4-5 and L5-S1. Little stick and burn, okay? Little numbing medicine. You're not going to like it. I'm going to inject it right now. It's uncomfortable, I know. Bear with me. All right. Very good. Needle down. All right, so we need to enter the body and the skin in a spot that makes sense to be able to get down to that L5-S1 disc. That's always going to be the hardest to reach. Shot. Lay still, you're doing great. I'm going to give him some more numbing medicine. Now, he doesn't only have back pain from two discs below his fusion, he also has pain from his sacroiliac joint. That's medicine going in to help you. Okay? Lay still, you're doing great. Everything's fine. Okay, shot. So, we're going to be treating the SI joint pain later. Dr. Patel is coming in to do that. I don't do the SI joint rhizotomies, but Dr. Patel does. It's a new treatment we're doing here at Deuk Spine. The sacroiliac joint turns out to be a pretty important cause of back pain. And a lot of people suffer with sacroiliac joint pain. As a matter of fact, our first patient today, she's a Canadian. She was here earlier having surgery. AP, she had SI joint pain on both sides. How is our viewership? Henry?
It is getting there.
All right, good.
Oh, well, we just got an extra 2 viewers, so can't complain.
Okay, good. Well, before I go into too much detail, I want to make sure I don't have to repeat anything, so I'll wait a few minutes and let our viewership build up a little bit. Meanwhile, I'll keep working on navigating to where we need to be using my little needle. Are you uncomfortable there? Shot? Where do you feel it?
Feeling that in your back or your leg? Back.
Perfect. That's where we expect you to feel it. Lay still. I don't need you moving around. All right, AP. So before you go to the AP view, let me just show you guys. Stay there for a second. Can you see this, Henry? The sacroiliac joint is literally right here. Okay?
We see it.
You got one on the right and you got one on the left. And everybody's different. Some people have no sacroiliac joint pain. This patient has SI joint pain on the right. So we're going to be treating that as well today. I'm using my x-ray machine to go back and forth between a lateral side view and a front back view. Yep, that's perfect. We are in the perfect spot. You can see the needle is at the foramen and we're about to enter the 5-1 disc. Now the 5-1 disc is one of the discs that's causing him his pain. I'm going to prove that to y'all in just a minute. Lay still, you're doing great. Don't move. Where do you feel that?
In your back.
Yeah, that's where we expect it. You're doing great.
Got a little pinch there.
Going to give you a little more num-num. Numbing medicine.
He's numb.
You know, num-num's wonderful stuff. Right, Dr. Berndes? What would we do without num-num?
Lock those sodium channels.
That's right. We need to prevent neural transmission.
So Dr. Young went home to pack, back to my house.
Yeah.
He's catching a flight. I don't need
He's leaving?
Yeah.
Heading back to Vegas? Like good riddance type flight?
I think he's working tomorrow.
Huh?
He had pilots working tomorrow.
Really? Oh, it was, well, he enjoyed himself with you. And I offered him a job. So I told him, whenever you're ready, you let us know. He said, I can't start right away. And I said, you know what? We wait. We wait for the best. Right? We can wait a year if we need to. We can wait 2 years. Point is, when we find somebody who's a good fit, it's worth waiting for. It's up to you. I'm putting the offer out there. So he's going to have to decide.
Feel that, my friend? Try to keep your head low still.
Yeah. We're going to have you asleep in a minute. You're doing great.
Keep that head low still.
Good news is we're done getting where we need to go.
Where do you feel that? Your back or your legs? Feeling all the back.
How many years have you had back pain? 20 years? How old? How many?
He was 19.
Since he was 19.
40 plus.
Jeez, 40 plus years. 40 plus years, folks. Some more num-num? We're doing 4-5 on the other side, right? Go ahead and put a little right here for me. Perfect. Thank you. That's good. So we're going to go on both sides because he's got really leg symptoms on both sides. So he's got herniations on both sides. He's got leg symptoms on both sides. I want to just lay still. We're almost done. Num-num. Go ahead. Thank you. Let's get a stylet in there. Shot. Okay, once I gain access to the 4-5 on the right side, we're going to be able to get started. Lay still, Shot. You're doing great. Lay still. Lay still. Shot. All right, Shot. We're almost there. Almost done, my friend. You're almost done. Shot. Where do you feel that? The back? Huh?
In the back.
Where do you say?
Felt it in the back.
In your back? Yes? All right. So, now, who did your fusion? Who did your fusion?
Dr. who? Dr. Ricks.
All right. Where was that done? Georgia? All right. So he had a fusion done, and he was telling me, you know, that he thought after his fusion his pain would be gone, but it wasn't. He said it was worse. He woke up with the same pain and it was an even worse pain. So fusion didn't work for him. Okay. Now I looked at his MRI, and more importantly, I said, "Where is your pain?" And you could see the scar here from the fusion. Guys, see that? And there's another scar here. And these doctors that do fusions some of the worst people in the world. They lie to the patient. And they say, oh, we're going to do minimally invasive. And if you look at the scar from here to here and from here to here, he's telling the patient, you're not going to have a big incision. You're going to have a small incision. But by the time you add up the two incisions, it's this big. That's a big incision. So they play this little nut game, you know, put the nut under the cup, hey, shuffle it around, where's the nut? The show game. In reality, they're all big incisions. We're making a tiny 7 millimeter incision, no fusion, no hardware, and we're going to fix this pain. Are you comfy? Yeah? Any pain in your back right now? No? You comfortable? Good. I want you to be comfy. How bad is that on a scale of 1 to 10? What's the highest? What's the highest?
What's the number?
I know. Well, how high did it go on a scale of 1 to 10?
8.
It didn't go higher than an 8? All right. Is that where you get pain? So he basically jumped off the table, but he didn't give me an answer right away by the time we depressurized him. And anyway, he said it was an 8. To me, it looked like a 10, but whatever. It's concordant. He had 8 out of 10 at L5-S1. Okay? You better now? You're a little groggy because he's still waking up. But he had 8 out of 10 concordant at 5-1. Is it better? So we know 5-1 is causing his typical back pain. You see that? Ah! You hear that? He said, ah! You guys hear that?
Yes,
There
we
he
did.
goes again. All right? So how bad is that on a scale of 1 to 10? A 9? It only went up to a 9. You almost jumped off the table. It was only a 9? All right, 9 out of 10. Is that where you get pain? Good news. That pain is going to be gone permanently with the surgery, okay? You happy about that? All right. So, nice guy, calm, happy, no pain. I did the discogram injection. He almost flew off the table. You saw him tighten up. You heard him go, ah! And I asked him how bad it was. He said it was a 9 out of 10. To me, it looked like a 10 out of 10, but you know what? He's the one giving the numbers. Jordan, show us the tear. Henry, go to the lateral x-ray. All right, you guys see that tear right there? That black thing?
Yes, we do.
The dye should stay in the middle of the disc, right where the arrow is. But it's leaking out through a tear in the back. That's where all the back pain comes from. And it's getting on the nerves. That's why they get leg symptoms. Now show us L5-S1. There's a tear there as well. Yep, that's the annular tear. Okay, we're going to go in there and clean that out, and it's going to take away his back pain. Thank you. Let's go ahead and come back. We're going to start with 5-1 on the left shot. We got our guide wire there. Took out the needle. I'm going to run my dilator down. It looks like a metal pencil. It's literally going to separate the fibrous tissues apart. We'll give it a little more num-num. Num-num is our word for numbing medicine. It's basically lidocaine and marcaine shot. So we're giving a short and long-acting numbing medicine just to help ease the discomfort of the procedure for the patient. Shot. We also put numbing medicine in the dye. We inject in the disc during the discogram. Aha. You learned one of our